Marjorie Dixon is here. I love that we're talking about this.
Yeah, I know.
It's all about managing menopause,
Yeah.
and you know, I get tweets and posts on my Facebook page all the time from viewers who would love for us to deal with this, and we have in the past, but it's there's so much information, and I think there's so much help needed that we could speak about it ad nauseum.
It's probably the #1 thing when people stop me on the street. They'll be like, "Listen, I'm dying. Can you tell me what to do? I'm so hot all the time."
Yes.
That's what I get.
Well, we hear a lot about the hotness, the hot flashes, but there are a lot of other things that we might not be aware of, and I learn every time we talk about it. So let's just start with the definition. Where did this all come from? How did it all start?
Menopause means menses pausing, so the stopping of your menstrual cycles. But there's more than just the stopping of the menstrual cycles that happens.
Yes.
And that's what is often surprising to people. People know menopause happens somewhere 40s to 50s. It can be premature. It can happen before 40, in which case people need to talk to their doctors. But the average age of menopause is 51. But if you think way back to Aristotle, Aristotle talked about menopause, believe it or not.
Really?
Yeah, he described it as when women cease having their menstruation at age 40. So way back when, it was earlier.
Oh, interesting.
Yeah. And then later on in the 18th century, they thought that it was associated with when women went crazy.
Oh.
No, that's what they said.
Funny that.
Well, but there's a little bit of truth in everything that gets said. So I'm not saying that women go crazy, but there is definitely we're estrogenized right now. I have a lot of estrogen coursing, so do you.
Yeah.
When we have our periods, every time it's a reminder of the fact that our brain is talking to our pituitary gland, that's sending hormones to our ovaries to tell us to ovulate. Estrogen abounds, and when it goes away, we feel it.
Right.
Every tissue of our body that has estrogen receptors senses it. Now, the most pervasive problematic thing that women sense, and 70% of women have it, is the vasomotor symptoms. So the centers that regulate your temperature in your brain, in the hypothalamus, the higher brain centers, are sensitive to estrogen being taken away.
Okay.
And therefore, you get these really, it's not even like I'm always cold and Jamaican. I'm not programmed for cold, I'm programmed for heat.
Yeah.
But other people feel like they are burning from the inside out. It doesn't sound good. Like if I have a woman in my office and she's sitting across from me and she's like, "You have to help me. I'm on fire every day." And especially they'll say, I wake up in the middle of the night and I get hot, but I sweat, and then I'm cold, and I wake up and it's like someone took a bucket of water and threw it into my bed.
And then you're freezing.
I'm freezing and I'm shivering, so I have to strip, and then I change the sheets, and my partner is all snoozing, and I'm mad because they're comfortable and I want them to be as miserable as I am. So that is when estrogen goes away, so your thermoregulatory centers, or your ability to manage temperature, changes. And sometimes people's baseline temperature just goes up.
Right.
And menopause is not just the kind of your periods get more infrequent and then there's 60 days between them. So instead of the regular during your normal reproductive lifespan, it's every 28 days-ish. It turns to 60 days, then it gets longer, and the official definition of menopause is 1 year without menstruation.
1 year without.
Yeah.
I want to know, are there certain things that will trigger your temperature, to just go?
To have a hot flash or flush. People say flushes or flashes, it's hot. So sometimes it's drinking wine.
Okay.
Yeah, so sometimes people have to stop doing the things that used to make them calm and happy.
Yes.
Yeah. So there's that. Sometimes it's someone who would ordinarily not have annoyed you so much, but because also you are a little more irritable, that will make you, so having a confrontation with someone.
Yeah.
So, and then it shows, that's the difficult part. So it shows all over you. You don't just get hot, it shows on your face.
Yes.
So you'll get like sweaty.
For
and your face,
sure.
some women's whole face and neck gets all red.
Oh, okay.
So those are vasomotor signs. But that's not just the only thing that happens with menopause. So there's that. There's also estrogen being taken away from the other tissues of your body. And some of the very important tissues are your vagina. And so your urogenital system also feels the pain, I guess, of estrogen being withdrawn. And actually, as a gynecologist, when I examine women in my office, when women come to me and they're postmenopausal, I'll pick a different speculum to do an exam with.
Okay, so does that have to do with the shortening of the vagina?
Yeah, shortening.
What does that mean?
That means that sex can be very painful.
But like it's actually changed the size?
The size and the tissue. So actually there are what we call rugae, or kind of ridges in a vagina.
Yeah.
Those thin out and go away after estrogen goes away.
Okay.
There's fewer secretions in the vagina, so there's not as much lubrication of the vagina.
Right.
And because estrogen is part and parcel of the development of the tissues of the vagina and the bladder and urethra, so where you pee from, you also get urinary irritability, sometimes more frequent urinary tract infections, urgency while going to the bathroom. But back to the vagina, because I think it's important to talk about this.
Let's get back to that vagina,
let's get back to the vagina. Not just for women, but for their partners. She's important. She's a she, I guess.
I think
she has to be a she.
I think she should be a she.
But it's important for partners also to understand that your sexual habits will be different. Because, you know,
there might be pain in certain positions.
Exactly.
You might have to
or not just certain
up.
positions. What used to fit doesn't necessarily fit so well anymore.
Right.
Right. So I think that it's important for people to know that this, like death and taxes, is kind of an eventuality.
It's going to happen.
It's going to happen. So it's important to be able to know that it's coming. And when these changes start to happen, you can do something about it, but you can't change it. So you're going to have to not just look for a pill or look for some medication, because we all know about hormone therapy. Estrogen, okay, you take my estrogen away, just give it back, I'll take a pill, it'll be good. Well, those come with some risks as well.
Yeah, well, they're very controversial.
Well,
sort of.
Sort of. So way back when I trained, makes me sound ancient, but 20 years ago, when I was first training, estrogen should have been in the water for all women.
Right.
So we used to call it hormone replacement therapy, and it was what we needed to do so that we didn't get irritable, moody, forgetful, have to pee all the time, complain about the fact that our breasts are no longer full. Yeah, estrogen affects the tissues of our breasts, so they get more fatty and more less perky.
Yeah.
So
I'm already there, and I'm not through menopause yet. I'm in big trouble.
Just wait, it gets better.
It gets even better.
So at that time, it has to be there. And then there were these studies that came out and showed that, well, maybe long term there was a slight increase in the risk of breast cancer, and there was an increase in the risk of stroke, and it wasn't as protective of the bones as we thought. So now we go back. If women are really having a hard time with symptoms, you can have local estrogens. You can put a little tablet in your vagina, doesn't pass through your liver, and so you can put a little ring into your vagina that sits on your cervix. It secretes a little bit amount of estrogen locally so that sex can be okay again.
So there's other options.
There's
so much to discuss that we're going to, and I need some good news.
I'll give you good news.
So let's discuss some of the tips to help you get through it, and some good news that might come with menopause, because there's got to be some good, okay?